talk about the surrounding the dragon of back pain. That is essentially a term in the Chinese language that we are going to use as to represent the holistic way or the integrative way that we approach any sort of problem, and in particular, back pain. Learning objectives for today is going to be about exploring the back as a part of a holistic, fully integrated cybernetic system. So we are a system of systems, and how that relates to finding back pain is often one of the questions I get from a lot of practitioners is, what do I do first? And so we have a IMS level 4 that is specifically geared towards going through the totem pole. It is essentially the metaphorical symbol of the way in which you would figure out, what do I need to do first in order to find out what the chicken and the egg is to this problem. So the totem pole is, like I said, something that Paul came up with many, many years ago. And to this day, we have about 144 research studies to validate this totem pole and the accuracy of the flow of it, from a higher order control system to a lower level control system that essentially is based on what a body, an individual needs to maintain life or to stay out of pain. What we're going to talk about today is this totem pole as it relates from the top. We're going to go through each system, starting with the respiratory apparatus. And what we're going to talk about is how this particular system affects all the systems underneath it. The highest control system in the body, the most important, is the respiratory. Below that, we'll go and talk about the mastication. Talk about the mastication system and how the mastication, if in dysfunction, could at some point be affected by all the other systems below that, and that's how you figure out what you're to do next, is looking at the systems that lie below the higher order system or the hierarchical systems. So from mastication, we deal with the ocular system. From the ocular system, we deal with the vestibular system and the auditory system. They go hand in hand. From there, we'll drop down to the occipital upper cervical system. And then from there below, subservient to that, is the organs and glands. And in between, you'll see there's a little frowny face, or basically it's called the emotion or limbic system. Represents the emotional set of an individual. We'll talk about that and how it affects all the systems above and below. And also why the emotional system, even though it's set underneath the organs and glands, how it can float all the way to the very top and trump the respiratory apparatus system. Then we'll move into the sacral coccyx, and then below that, the slave joints, and what the slave joints are and what they represent in the body. So, in other words, your chance of death increases when there is dysfunction in the higher order systems, i.e. breathing. We do it 25,900 times on average a day. Very, very important system. Within 3 minutes, essentially go brain dead. Within 5, you're probably going to be a vegetable unless you're some sort of yogi or somebody that's trained your breathing apparatus. The body will make adaptations in its physiology anywhere below the systems of respiratory so that you can breathe. We look to the root of it. So could be a mental emotional cause. It could be a dietary cause as it relates to organs and glands, i.e. food allergy, a growth and development issue, an orthopedic obstruction, a malformed nasal passage. If it is, it's important that you figure it out, which essentially would be the root, and if you can't deal with it, then you refer out. For example, I've had several clients, when addressing the respiratory system and their breathing apparatus, they had a deviated septum, which was inhibiting normal breathing patterns. So I can't deal with the deviated septum. So I referred out. Now, if I did not refer out, then anything that I tried to do that would help this person would not work, because the breathing, which is the highest at the totem pole, which is the most important, and which is basically responsible for all the systems below that to maintain healthy, balanced physiology, would be disrupted, and my time and their time would be wasted. So they're better off spending the money, time, and energy to go ahead and get that respiratory function fixed, so that everything below would just eventually, with time and effort and balance, find its way into healthiness and balance. So let's talk about the first system on the totem pole, which is the respiratory system. The respiratory is vital. Why? We already mentioned how many times a day we do it. Mobilizes the CSF. The CSF, that means the cerebral spinal fluid. That cerebral spinal fluid nourishes and removes metabolic waste from the central nervous system. It provides oxygen for cellular metabolism. It maintains the acid-alkaline balance within our body. And it moves life force energy, i.e. chi, prana, through the body. And if you're not familiar with what that potentially means for you, it's a healing element, this moving this chi and prana. Cerebral spinal fluid is like blood to the nervous system. And what that means is that cerebral spinal fluid, actually the mechanism of its flow/pump is basically done by the inhale-exhale mechanism. So every time we inhale, our spine straightens, and these curvatures within our spine lose their curvatures or reduce their curvatures, and the spine straightens. And that particular measure is probably about 1 to 2 centimeters if in a healthy individual. And a way that you can identify if and do you have much movement is just put your back, your head, your thoracic, and your bottom against the wall, and take a nice big inhalation, and you should feel your head move, which is your spine straightening. And then as you exhale, you increase your spinal curvatures. And through the process of inhalation, exhalation, straightening and increasing curvatures in the spine, cerebral spinal flow moves in and out of the ventricles of the brain through the spinal column, nourishing the nerves and the discs, which is essentially called imbibition. So imbibition, now that we've moved from nourishing the nerves through the breath of cerebrospinal fluid pump, we also have to talk about the aspect of imbibition. And imbibition is basically every time you breathe and straighten the spines, the spine and curvatures increase, which causes a compression on the disc. So a disc is a lot of water. It's like a sponge. So when you inhale, it squeezes that sponge and excretes the metabolic waste. And every time you exhale, where you increase your curvatures, that sponge or that disc pulls in nutrients and nutrition, which heals the disc. And so every disc, whenever in a pathology, takes about 500 days for the healing process. And it's important, if you want that 500 days, that you make sure that the breathing apparatus is working and functioning properly, so that it enhances the life of the disc and causes the healing. For those that are looking for a clear-headed mind and thought process to be quick, then we want that nourishment through the cerebrospinal fluid to go up into the brain and give that brain all its nutrients to give you those great ideas and to keep thinking, depending, just keep your ideas flowing. So the respiratory apparatus is imperative to creating stability emotionally. And what that means is the breath. We talked about the acid-alkaline balance. Well, if we're breathing, and just note, when I talk about breathing functionally, I'm talking about breathing diaphragmatically. And so when we do breathe diaphragmatically, and that really essentially means when we're breathing from our lower abdominal, the impetus of the start of a diaphragmatic breath is 2/3 from the abdominal region, and the last third is a vertical lift. So inhale, when you inhale, your belly gets larger, and quite frankly, it's very important that the breath start below the belly button. And so you feel that abdominal, and it gets larger. And as you take a deeper breath, you go into a lateral expansion of the rib cage. And with that lateral expansion, and as the breath increases, it then moves up and into a vertical lift. That is balanced diaphragmatic breathing. But oftentimes we lose sight of balance, and we end up getting stressed, and the body ends up breathing with its upper respiratory mechanism, where you just breathe sympathetically, or in the chest, or the shoulders tend to move. And that's a stressful breathing mechanism, and oftentimes will lead to an acidic person, or also a reactive person. And so when we talk about the emotions, acidic or sympathetic basically distorts the emotions that can make us very reactive and can make us very irrational. And the perception, because isn't stress perceptional, then the perception gets distorted. So in order for us to be responsive, in order for us to be balanced, to be more sympathetic, we breathe diaphragmatically. And with that diaphragmatic, we talked about the lower abdominal expansion happening. And as that expansion happens, let me just tell you, with the diaphragmatic breath, what's super important is the diaphragm. In order for that belly to expand, the diaphragm actually pushes down on the organs and glands. And when it pushes down, it basically, the belly comes out, and it's essentially a pump that detoxifies the organs and glands through the mechanism of the diaphragm, through diaphragmatic breathing. So with the pump of the diaphragm detoxifying the organs, it creates a detoxed internal system. With that decreased stress internally, we're able to take external stress and be responsive. But if we have an internal stressed body, meaning organ glands are toxic and they've lost the pump of the diaphragm due to diaphragmatic breathing, then we have an internal stress system compounded with an external stress, and that is hot mess. That's reactive. So when we become overly excess upper respiratory breathing, we reach that 5,000 times a day. And like I said, that's the general average. Most people, if we were looking at resources of super healthy people, or healthy people I should say, our breathing, our respiratory rate per minute should be about 8 to 10. And oftentimes in our assessments, one of the things that we want to assess in our clients is to see how balanced they are, and obviously to see if they're breathing correctly, but counting the number of breaths that we perceive in 1 minute. And the average healthy person is 12 to 16. If we're talking about someone who's in pain, then we're talking about more of a respiratory rate of 20 to 25, because pain is so sympathetic. So in this particular slide, we will talk about Major Bertrand DeJarnette, the author of Sacral-Occipital Technique and Spinal Therapy, second edition coming out in 1946. And this is back in 1946, this guy's talking about the art of stability of a joint. And so he talks about the importance of having stability in joint complex by way of working with the resistance and always having an equal and opposite contraction of either side of the joint for proper stability. And if not, there we have is dysfunction. And so when we talk about dysfunctional joint systems, one of the things that it's important to remember, and you'll see in this slide, that if you're going to do an exercise shown by the female that's doing crunches on the floor, she is not on an unstable surface. She's on a stable surface. So there is a one-sided contraction with zero resistance for stability of that joint. Now, specifically when we're addressing this particular type of exercise, The plumb line illustrates kyphosis, or a depressed first rib, or strangulating of the diaphragm, or improper posture, forward head. All these dysfunctions on a plumb line can be the result or effect of what she's doing on the floor, which is essentially a crunch, which is an abdominal crunch, where she's shortening the rectus abdominis in a zero ability of extension, but mainly just flexion, which tightens this muscle. And my point is, the guy in the picture shows the distortion, and that distortion, if done all the time and not countered with equal and opposite contraction and resistance, then they have a strangulated diaphragm. Okay, so what I'm saying is that exercise causes a respiratory dysfunction. Okay, so postural faults like that, dysfunction basically leads and is from tight rectus abdominis. And so when that muscle becomes very tight and strong and it's rock hard, nice and good, and you can go to the beach and look fantastic, but at the same time, if it's so hard and strong and shortened, can you then take a deep belly breath? In other words, the belly can't expand if this muscle is strung so tight. So basically, if that is what's happening, then it's locking down the rib cage. It locks up the thoracic spine. And then you have essentially overcompensation happening where? Well, the shoulder, the neck, the lower lumbar. These distortions lead to ultimate compression, torsion, and shear in the joints. And the respiratory problem leads to the forward head. As the head goes forward, the distance from the mandible and the sternum increase. And the tension in the submandibular muscles basically pull the mouth open because of that tightness. All from the rectus abdominis becoming tight causes that forward rounded shoulders, which creates that kyphosis. And don't forget, when I talked about the breathing mechanism, one of the things I talked about with an inhalation is that there's a lateral movement. So if your diaphragm is locked down, then you also decrease the lateral expansion, and the ribs that laterally expand are attached to the thoracic. So now you have a locked up thoracic that doesn't extend. And when I say shoulder compensation, due to the lockdown of the ribs and due to the inability for the thoracic to extend, the shoulder takes the brunt of that lack of extension in the thoracic. So people can't get enough airflow within their nasal passages, will have to open their mouth and get enough oxygen to normalize their physiology. So at the end of the day, we look at a positional posture on the plumb line that looks like him. I've mentioned a lot of roots and where it could potentially come from, but it's our job as practitioners to communicate, have conversations, look at past history, look at the intake form to find out what their root is. Because it can come from mental emotionals, it can come from child development breaches. But the end game, if not taken care of by you or in past practitioners, ultimately where this leads down the road is, yes, we have forward head, yes, we have rounded shoulders, yes, we have kyphosis, yes, we have a locked up thoracic, yes, we have a respiratory dysfunction, but we'll also have a pelvis that will migrate forward and ultimately lead to a layered syndrome. And with that being said, it's very hard to correct due to the line of the body being distorted for so long and the complexity of the systems being so dysfunctional that in some cases you might not be able to correct all of them. And so you'll have to investigate the root and go from there.